Meet Paolo Macchiarini, the charismatic thoracic surgeon who was once hailed as a medical revolutionary. Dubbed a miracle worker and superstar surgeon, Macchiarini captivated the scientific community with his groundbreaking synthetic organ transplants, boasting remarkable success stories. His innovative procedure, which involved implanting artificial tracheas infused with stem cells, promised to transform the lives of countless patients. However, beneath the glamour and acclaim, a dark reality unfolded. Patients began to die, and disturbing questions emerged about Macchiarini's troubled past, questionable methods, and reckless behavior. Today, the legacy of this fallen medical icon is shrouded in controversy and scandal. What drove Paolo Macchiarini's catastrophic downfall, and where is he now? Early life and career. Paolo Macchiarini's life began in Switzerland, where he was born to Italian parents. He took his first steps into the medical world by earning his medical degree from the prestigious University of Pisa in 1986. Following this, he pursued further education, obtaining master's and doctorate degrees in organ and tissue transplantation from the University of Franche-Comté in France. These qualifications laid the foundation for his future endeavors in the field of medicine. Macchiarini's professional journey was marked by numerous prestigious appointments. He began as an assistant professor at the University of Pisa, a position he held from 1990 to 1992. He then expanded his expertise by serving as a fellow at the University of Alabama at Birmingham in 1989, although the university later clarified that his fellowship was in the hematology and oncology department for 6 months, contrary to his claim of working in the Department of Thoracic Surgery. Macchiarini's career progressed as he became the head of the Department of Thoracic and Vascular Surgery at Heide House Hanover Hospital, a position he held from 1999 to 2004. His expertise also led to his appointment as an investigator at the Institut d'Investigación Biomédique in Barcelona, Spain, from 2006 to 2009, during which time he was affiliated with the University of Barcelona and Hospital Clínic de Barcelona. Macchiarini's rise and downfall. Macchiarini's rise to international prominence began in 2008 when he successfully performed a groundbreaking procedure on Claudia Castillo, a young woman from Barcelona. He created a new airway for her by chemically stripping away the cells of a windpipe taken from a deceased donor and seeding the bare scaffold with stem cells taken from Castillo's own bone marrow. The procedure's success catapulted Macchiarini to fame, earning him recognition as a pioneer in synthetic organ transplants. His reputation led to further esteemed appointments, including a visiting professorship at University College London from 2009 to 2014 and a consultant and project manager position at University Hospital Careggi, starting in 2010. In 2010, Macchiarini established ties with Russia after conducting a master class at the invitation of politician Mikhail Batin. This led to widespread media coverage and his subsequent appointment at Kuban State Medical University in 2011, funded by the university and the Russian government. He also received an honorary doctorate during this time. Macchiarini later moved to Kazan Federal University in 2016, but his research project was terminated by the university in April 2017. Additionally, he held a visiting professorship at the Karolinska Institute in Stockholm from 2010 until his research contract was terminated in 2016. On a personal note, Macchiarini married Emanuela Pecchia in 1986, with whom he has a daughter and a son. His charismatic personality and impressive professional credentials once earned him the nickname Super Chirurgo, or super surgeon, in the Italian press. Paolo Macchiarini's surgical career was marked by a series of innovative yet controversial procedures involving tracheal transplants. His methods garnered significant attention and acclaim, but ultimately, many of his patients suffered severe complications and died. Macchiarini's breakthrough procedure in 2008 was when he transplanted a trachea into Claudia Castillo, a young woman from Barcelona. He used a donated trachea stripped of its cells and seeded it with Castillo's own stem cells. The operation was deemed successful, and Castillo was able to return home. In 2010, Macchiarini performed a similar transplant on Kieran Finn Lynch, a 10-year-old Irish boy born with a narrow trachea. The procedure involved seeding the stripped trachea with the boy's stem cells just hours before implantation. Macchiarini's subsequent surgeries, however, were met with tragic outcomes. Keziah Shorten, who underwent a tracheal transplant in 2010, died in 2012 due to complications from hospital-acquired pneumonia. Jadira Iglikova, a 25-year-old Russian woman, received a seated donated trachea in 2010, but succumbed to chronic pneumonia, a tracheoesophageal fistula, and severe malnutrition in 2010-2018. In 2011, Macchiarini collaborated with scientists at University College London to create a fully synthetic trachea for Andamariam Teklesenbet Bayene, an Eritrean man with tracheal cancer. Although the operation garnered significant media attention, Bayene died in 2013 due to complications. Macchiarini performed similar synthetic tracheal implants on several other patients, including Christopher Lyles, Yulia Tulik, Alexander Zozulia, Yesem Keter, Hannah Warren, Sadiq Kanayan, and Dmitry Onogda. Most of these patients experienced severe complications, and many ultimately died. Macchiarini's innovative techniques, particularly his use of synthetic scaffolds seeded with stem cells, were initially hailed as revolutionary. However, the catastrophic outcomes of his surgeries raised serious concerns about his methods and judgment. By 2014, Macchiarini's reputation had begun to unravel, and his work was subject to intense scrutiny. An investigation into his research and surgical practices was launched, revealing disturbing discrepancies in his reporting and potential breaches of medical ethics. Today, Macchiarini's legacy is marred by controversy, and his once celebrated innovations are viewed with skepticism. Allegations and controversy. Paolo Macchiarini's illustrious career was marred by allegations of scientific misconduct, research falsification, and patient exploitation. The controversy surrounding his work began to unravel in January 2014, when one of his patients died, triggering a series of events that would ultimately expose his deceptive practices. Later that year, reports of suspected misconduct in research were filed, accusing Macchiarini of falsifying claims in his research papers, misrepresenting patient outcomes, failing to obtain ethical approval for some operations, and misrepresenting work done on animals. An external expert, Dr. Bengt Gerden from Uppsala University Hospital, was appointed to investigate the allegations. Gerden's report, released in May 2015, found Macchiarini guilty of scientific misconduct in 7 papers. However, Karolinska Institute's KI Vice-Chancellor, Dr. Anders Hamsten, initially dismissed the findings, sparking widespread criticism. The situation escalated in 2016 when a documentary series, Experiment 10, exposed Macchiarini's deceptions. The documentary revealed that patients' medical conditions were misrepresented in academic papers, synthetic tracheas were implanted without proper testing, and patients suffered severe complications and deaths. The shocking revelations prompted KI to terminate Macchiarini's contract and sparked a national investigation. In October 2016, the BBC broadcast a 3-part documentary, Fatal Experiments: The Downfall of a Super Surgeon, further highlighting Macchiarini's misconduct. The Swedish National Scientific Review Board subsequently concluded that 6 of Macchiarini's publications resulted from scientific misconduct, leading to calls for the retraction of the papers. Macchiarini's reputation was irreparably damaged, and his legacy now serves as a cautionary tale about the dangers of scientific deception. His actions not only harmed patients, but also undermined trust in the medical community. Macchiarini faced additional allegations, including patient extortion in Italy, which was later dismissed, and falsifying his CV. The fallout from his actions led to widespread condemnation from the medical community, with Professor Pierre Dallaire describing the synthetic trachea procedure as equivalent to a firing squad due to the immense pain patients suffered. Macchiarini relationship with Benita Alexander. Benita Alexander, an Emmy-winning producer, met Paolo Macchiarini in February 2013 while working on the NBC News special A Leap of Faith. At the time, Macchiarini was gaining international attention for his pioneering work in regenerative medicine, particularly his synthetic organ transplants. Alexander was immediately drawn to Macchiarini's charismatic personality and groundbreaking medical achievements. As Alexander spent more time with Macchiarini, she found herself opening up to him about her personal struggles. Her ex-husband was battling brain cancer, and her second marriage was on shaky ground. Macchiarini offered emotional support and guidance, listening to her concerns and offering words of comfort. Alexander described him as an amazing friend and a solid, reliable pillar of strength during that difficult time. As their professional relationship blossomed into a friendship, Alexander and Macchiarini's interactions became increasingly personal. By June 2013, their connection had turned romantic. Alexander recalled an incredibly romantic weekend in Venice, marking the beginning of their whirlwind romance. Over the next few months, they spent extensive time together, with Macchiarini showering Alexander with attention and affection. Macchiarini proposed to Alexander on Christmas Day 2013, and she happily accepted. He promised her a lavish Italian wedding, claiming that Pope Francis had agreed to officiate the ceremony. He even told her that the Vatican had offered the Pope's summer residence in Castel Gandolfo for the 4-day wedding celebration. Alexander was swept up in the romance and began making wedding plans, including having 4 dresses made for the occasion. However, Alexander's fairy tale came crashing down in May 2015. Just as she was preparing to move to Europe to be with Macchiarini and leave her job at NBC, she received an email from a friend who raised suspicions about Macchiarini's claims. The email linked to an article about Pope Francis's summer plans, which did not include officiating Macchiarini's wedding. Alexander confronted Macchiarini, who provided unconvincing explanations. Further investigation revealed that Macchiarini was still married to his wife of 29 years and had another mistress and children. Devastated by Macchiarini's deception, Alexander canceled the wedding and hired a private investigator to uncover more about his past. On what would have been their wedding weekend in July 2015, Alexander, disguised in a blonde wig, and 2 close friends confronted Macchiarini at his home in Barcelona. While Alexander waited in the car, her friends confronted Macchiarini, who was caught off guard and embarrassed. Alexander chose not to speak to Macchiarini directly, marking a definitive end to their tumultuous relationship. What went wrong for Macchiarini? Macchiarini's past was marked by personal tragedy, including the loss of his father, whom he claimed to have been unable to save. This experience, Alexander believed, had driven Macchiarini's passion for medicine. However, Macchiarini's professional life began to unravel in November 2014, when the Karolinska Institute in Sweden launched an independent investigation into his methods. 4 physicians filed detailed complaints, accusing Macchiarini of failing to seek ethical approvals and misleading medical journals about his patients' outcomes. The investigation revealed that Macchiarini had implanted synthetic tracheas without testing their viability, citing urgent patient needs as justification. Yasim Setir, one of his transplant patients, underwent multiple surgeries, including a human donor trachea transplant in 2016, but ultimately died in March 2017. As accusations against Macchiarini mounted, Alexander remained loyal until the Pope debacle in May 2015. After their breakup, Macchiarini's contract with the Karolinska Institute was terminated, and several high-ranking officials resigned. Macchiarini maintained that his patients' welfare was his primary concern and welcomed international discussions on ethical processes. In response to the independent investigation's findings, Macchiarini shifted responsibility to hospital administrators, claiming it was their job to secure ethics approvals. Despite the controversy surrounding his work, Macchiarini remained convinced that his synthetic trachea technology was viable. The fallout from Macchiarini's actions led to widespread criticism, with many questioning how he was able to conduct experimental surgeries without proper oversight. The incident highlighted the need for rigorous ethical standards and transparency in medical research. The trial and arrest. Paolo Macchiarini's downfall culminated in June 2023, when he was found guilty of gross assault on 3 patients and sentenced to 2.5 years in prison by a Swedish appellate court. The case began with allegations of misconduct, including lack of ethical permission and misrepresentation of patient outcomes. An external expert, Dr. Bengt Geerden, concluded in May 2015 that Macchiarini was guilty of scientific misconduct. However, the Karolinska Institute's vice-chancellor, Dr. Anders Hamsten, initially threw out the report, and Macchiarini's contract was extended. In 2016, Vanity Fair exposed Macchiarini's personal lies, including his fabricated wedding plans with Benita Alexander, a journalist who had fallen in love with him. The article also revealed false claims on his resume. The backlash led to Macchiarini's termination from the Karolinska Institute. Macchiarini was charged with aggravated assault and bodily harm in a Swedish appeals court. The prosecution argued that he had acted with criminal intent, causing harm and suffering to his patients. The court ultimately agreed, finding Macchiarini guilty and sentencing him to 2.5 years in prison. The appellate judges concluded that Macchiarini acted with criminal intent, was aware of the risks of harm and suffering to his patients, and showed indifference to the realization of those risks. Macchiarini maintained his innocence, stating he was being treated like a war criminal. He claimed his colleagues and supervisors approved the surgeries and would appeal the sentencing. Macchiarini is currently serving his 2.5-year prison sentence in a Swedish prison. His case serves as a stark reminder of the importance of medical ethics, accountability, and the devastating consequences of hubris and deception in the medical profession. The Karolinska Institute's protection of Paolo Macchiarini. The Karolinska Institute's handling of Paolo Macchiarini's case has raised serious concerns about the institution's commitment to medical ethics and accountability. Despite whistleblowers' reports of misconduct, including lack of ethical permission and misrepresentation of patient outcomes, the institute initially protected Macchiarini. When the New York Times published an article detailing the allegations, the institute threatened to fire the whistleblowers for allegedly violating patient privacy, issued formal warnings, and even reported them to the police for alleged ethics violations. The institute's actions were further compromised when, following an external inquiry that concluded Macchiarini was guilty of scientific misconduct, its leaders publicly disavowed the findings and expressed confidence in Macchiarini. This move was supported by The Lancet, which published an editorial titled, "Paolo Macchiarini is not guilty of scientific misconduct." The whistleblowers, Carl Grinamo and Matthias Corbaccio, faced significant backlash, including hostility, social isolation, and fear for their careers. The Karolinska Institute's actions have been widely criticized as a stark example of institutional failure to prioritize patient safety and scientific integrity. The progression of Macchiarini's sentence. In June 2022, Macchiarini was initially cleared of 2 of 3 aggravated assault charges and given a suspended sentence for the third. However, Swedish prosecutors appealed the sentence, stating that Macchiarini's interventions were completely unlawful human experiments, deserving of a long prison sentence. In June 2023, a Swedish court upheld the conviction and sentenced Macchiarini to 2.5 years in prison. Macchiarini maintained his innocence and initially planned to appeal the decision. Macchiarini's conviction marked the end of a decade-long controversy surrounding his pioneering work in regenerative medicine. His case drew widespread attention, inspiring multiple documentaries, podcasts, and even an opera. Following his conviction, Macchiarini's research papers were retracted, including 4 from the medical journal The Lancet. The retraction highlighted the need for rigorous ethical standards and transparency in medical research. As part of his sentencing, Macchiarini was expected to serve his prison term in Spain, where he resided. However, the transfer process was complicated due to Macchiarini's Italian citizenship. Where is Benita Alexander now? Benita Alexander, an NBC News producer who had a romantic relationship with Macchiarini, played a significant role in exposing his deceit. Alexander discovered Macchiarini's false claims, including his marital status and his purported connections to Pope Francis and Andrea Bocelli. Alexander has since become an advocate for victims of romantic deception, speaking extensively about her experience with Macchiarini. She has appeared on various documentaries, podcasts, and TV shows, including Investigation Discovery's He Lied About Everything and ABC's The Con. Alexander currently serves as CEO of Baraka Productions and produces the podcast Benita and the Barakas, which elevates the voices of women victims of fraud. In conclusion, the Paolo Macchiarini case serves as a stark reminder of the devastating consequences of hubris, deception, and the erosion of medical ethics. Macchiarini's actions, driven by ambition and a desire for fame, resulted in the suffering and death of innocent patients. His manipulation and exploitation of those who trusted him, including his patients and loved ones, are a betrayal of the medical profession's sacred trust. The case highlights the importance of rigorous oversight, accountability, and transparency in medical research and practice. It also underscores the courage and resilience of whistleblowers, like Benita Alexander, and the researchers who first raised concerns about Macchiarini's conduct. As we reflect on this disturbing case, we honor the memories of the patients who suffered at Macchiarini's hands and acknowledge the pain and trauma inflicted on their families. Thank you for watching and following along with this disturbing yet important story. If you'd like to learn more about medical ethics and accountability, consider subscribing to our channel for future updates and documentaries. Subscribe now and join our community of informed and engaged individuals.